All right. As we were stating earlier, we're going to discuss muscles of the torso and the back, for instance. And with that, I had scanned in a few documents or PDFs, if you want to call it that. Okay, man, I'm trying to operate this left-handed backwards and upside down, it seems like. Let's see here. Okay, I think probably we'll just go ahead and start with this guy here. Okay. And what we see happening, there's not a whole lot to see here. I think that one of your questions on your handout that we had discussed yesterday was talking about intercostal muscles, for instance, and that was tied in with that of respiration. And when we talk about muscles of respiration, there's mainly two groups, and what we mean by that is, okay, at the bottom here, which would separate your thoracic and your abdominal cavity, is that diaphragm in here, okay? So that's a major muscle of respiration, as well as all of these, okay, you could say these internal intercostal muscles, because a lot of them, as you can see, are actually underneath the rib cage. And you can't tell from this diagram, but they actually hook up to your ribs, because what happens is your diaphragm, as that pulls down, okay, that increases the atmospheric pressure inside of your lungs. Okay, so when it does that, for everyone in here, as we just passed the gas laws, okay, especially Boyle's law, since it deals with pressure, is as that pressure goes up, when this pulls down, it decreases the pressure, so then it causes air to flow in, because as pressure is going down, the volume then is going up, because remember, Boyle's law is an inverse proportion, okay? So then what happens is as that air flows in, the chest cavity expands. Then in order to get that air out of there, it's these internal intercostal muscles, okay, and external intercostal muscles that actually forcefully contract. So then what happens is that increases the atmospheric, or increases the pressure in the lungs above atmospheric pressure, so then it actually flows out. So then as the pressure is going up, then the volume goes down, and that's why your chest cavity will then start to deflate, okay? So again, we said go ahead and skip that question. As you can see right here, we got that pectoralis major that's cut. Of course, that's going to be one of the major muscles that's going to be identified in your cat when we get to that section. And there's also a pectoralis minor. We really don't talk about that much in humans, okay? Mainly because it's not so much that it's a deep tissue muscle, it's just that it's hard to see because that pectoralis major is covering that up, okay? Then, as we proceed forward, what I like about this diagram is it's talking about superficial muscles that you would see up on top, and then some of your deeper tissue muscles. And some of these are actually going to be repeated in the cat, okay? We don't talk about this levator scapular. It's actually called that in the ventralis in cats. And the reason that some of these muscles would be named differently, they're found in similar locations, is that they would have different functions. Okay, because you got to remember that us as humans, we are bipedal, how we walk on two legs. Well, dogs, cats, cattle, sheep, pigs are all quadrupedal animals, so they actually, of course, walk on four legs. So the different types of movements in the shoulder is going to be much, much different than that of humans. Okay, so let's move to a deeper tissue side, and I think this is the back then. Okay, and I think there's one more that I should have scanned in, but these similar pictures that you might want to refer to if you have the book can be found on page 321. Okay, that's where it begins with these back tissue muscles. and then some of those in the chest, as you would guess, maybe a little further along. Let's see, maybe that's also on page 321 as well. It's got a posterior side. Oh, actually 319 would be a good place to look then as well. Okay. Now, with our discussion that we had yesterday, one of the questions that was referring to is what would you be doing if you were having to paddle your boat and you're up a creek without a paddle? And once we got past that saying, no pun intended, we're illustrating, well, how would you actually paddle your boat with an oar? Well, we're presuming that you've got two paddles, okay? We're not doing one of these where it's just one. It's going to be a type of rowing motion like this, okay? I don't know if that's probably a specific type of dance move where they're doing one like this or something like that. I don't know. Okay, we had our laughs for it today. All right, so what type of movements would be doing this, okay? We know that we're pulling back. That would be the first one to think about, okay? So it's a muscle that would be found on the anterior side, okay? So that being pulled back would be right here. Now, I just misnamed this. This should have said, that's what's confusing. It says torso back. This is actually torso front. So that's that first type of movement. You're flexing your arm, okay? So then what has to happen is after you do that flexion, okay, you got to pull that oar out of the water. And upon doing so, okay, so you pulled back, then you have to lift up and rotate forward. So what is it that raises the arms? Okay, well, that's the function of this muscle right here. Okay, so that's going to raise that paddle because it's attached to your arms up out of the water. Okay, and then you have to push that forward. Okay, so then upon doing so, that would be an action of the triceps. Okay, and then you're going to start your next rowing motion, which is your biceps, and then you're also pulling your shoulders down. And we didn't include that earlier because that's the function of this very large, probably one of the largest muscles in the body, your latissimus dorsi right here, which actually pulls the shoulders down. Okay, so you have your major muscles, your biceps, your triceps, your deltoid, and then your latissimus dorsi. Okay, so some other muscles that we want you to know. I'm afraid that, I should have the rhomboideus muscles in here someplace. I was thinking I had 4 scans. So let me just pause this for just a moment, see if I got that scanned in. Okay, it would appear that I thought I had a better diagram of this, but I see it would appear that I deleted that before I got it on this disk because I scanned it into the copier on Monday, and then I just did not get it transferred in. But what we can do is, if you have on or around page 319, okay, notice that sometimes when we're talking about these muscles, okay, it's going to be the size that will perhaps say if it's the pectoralis major, pectoralis minor, or sometimes it's orientation, if one's on top and one's on the bottom. So in this case, when you look on page 319, the rhomboideus major and minor would be a good example of that. Okay, the rhomboideus major, which is actually a little bit larger, and that's in this vicinity right here, because what that does is it moves up in this orientation right here. It has a rather wide muscle, about like this. It goes up in there, and it's much larger than that of the rhomboideus minor, which is actually sits on top of it. So you have the rhomboideus major here, then the rhomboid minor is actually on top of that. And again, you can see this on I don't know how well on page, well, not with this diagram on here. You can see this on page 319, and that's what we're referring to right here. Okay, so we want you to know the trapezius, of course the deltoid, the rhomboideus minor, rhomboideus major, and the latissimus dorsi. Then, as you look at diagram A, which is up above what we just went through on these bottom sets here, okay, again, rhomboideus major, minor, the teres major, and then also the teres minor. And I believe that was it for that group. Okay, and then there's also a better designation on page 321 that you might see. Okay, it actually has these separated out a little more clearly because it's more so of a deeper tissue of the back of the shoulder. Again, teres major, minor, and the infra and supraspinatus. Okay, so I want to spend a little more time on that of the arms because that's probably a little more difficult to actually look at, and I know I've got those on here. What I like about this here is that we can actually has the names wrote right in here. Okay, this is a little larger. Maybe this is a little easier to see. That one's probably easier than that other one, but especially this one right here. Okay, you still see some of the muscles that were in that larger diagram. Okay, the biceps, of course, flex the arm. The triceps then extend it. So here you see an anterior view and a posterior view. The brachioradialis, we want you to know. Okay, and also the brachialis. Okay, so 1, 2, 3, 4. Also the brachioradialis. What happens is on an anterior view, this actually wraps itself around, and then that's what you're seeing on the back side. So this actually flips itself around. Now we see it on the front view, the brachioradialis. Okay. Then I think it's a little easier to see on this other diagram, and that is this one right here. Okay, you're going to see some of those same muscles. Okay, let's see here. Actually, maybe, yeah, here's your brachioradialis. So then this is actually a posterior view where you're putting the hand right there. Okay, and get this maybe in focus a little more. Maybe it's just my eyesight that's, because I take my glasses on and off. I guess it was probably about right. Okay, so brachioradialis, flexor digitorum, we want you to know that. And then this supinator right here. That's all that we want you to know for those, okay? At least for today, okay? We're taking this nice and slow and trying to chop this up into bits, okay? So the major muscles we want you to know, again, in the back are the latissimus dorsi, okay? The trapezius, okay? And then also your deltoid muscles. Then when we get down into the arms, which is a little more difficult to deal with, we see this diagram again. I think it's just much better because it's actually bigger to actually see. Then here's maybe a little more detailed view of what it is that we're looking at here. Okay, chances are, again, just looking outside from our basement, it just does not look good. That, I don't know, I think we'll still be at home tomorrow. So next thing I want to do is go over some of these muscles as far as what their origins, insertions, and actions are. Okay, I think there's 10 that we're going to go over. So in this case, I just went ahead and put 5 of them there. And as we look at this, okay, so knowing where these muscles are, of course, is going to be a great benefit as far as what they actually do. Okay, so then let me try, I think this purple marker will show up too, because I don't want these to be right next to one another, then we get that confused. So the O is the origin, the I is the insertion, and of course the action is actually what it does. So what we had discussed yesterday, what's the difference between these two? Okay, remember the insertion gets pulled towards its origin. This moves, this does not. So then as we look at this, okay, we know the action for the masseter closes the jaw. Closes jaw. Okay, does that show up? Yeah, that shows up pretty decently. So then if it's closing the jaw, like what it does here, what is it that's actually moving? Well, your mandible does then. Okay, so if that's the case, if the mandible's moving, that's going to be the insertion. Mandible. Okay, so then what is it on the skull that does not move? Okay, well, if this is getting pulled towards its origin, well then that's why we have this cheekbone right here, your zygomatic arch, or we can just put zygomatic bone. Okay, then this is actually named after its closest bone, and we've talked about in class, this is actually a supplemental muscle. So if temporalis looks familiar, well then the reason that is because this is actually on the temporal bone. Of course, your temporal bone is not going to move, so that would be the origin. Okay. And then what is it that's actually going to move? Well, of course, that would be that of your mandible. Okay? So then that's where the origin is going to take place, on the mandible. And since it is a synergist, it aids another muscle, which it does, that would be closing the jaw. Okay? So when we look at this, the deltoid, if we know what it does, we can differentiate what the different origin and insertions would be. Okay? So if that's the case, let's see here. Deltoid, we know that part of rowing your boat or moving a paddle, we know that it raises forearm. Raises, or just raises arm, I think would be fine. And does that show up? Not very good. So I don't think we want to use green. Okay, so I guess maybe we'll just have to stick with purple here. Raises arm. Okay, so then in order to do so, where is it that this muscle that does this action, where on the skeleton would it be oriented to where something that does move to something that does not move? Okay, so then we know that if it's raising this arm, it has to insert somewhere on your arm. And of course, from our last chapter, we know that would be the deltoid. What do you think? Okay, and if you said tuberosity, that would be correct. Okay, so then if that's what does the moving down here, it has to be pulled towards this insertion. So then we're just going to put scapula. Okay. Then one of the common muscles that we talked about was that of the trapezius, which is muscle of indecision. So again, think of what a nonverbal answer to a question would be as far as movement of this muscle. So if you're asked a question, you don't know, well, it's not that it raises the arm, yes, that's true, but it raises the shoulder instead. So if it raises shoulder, that's what it does. Well then, where is it actually going to originate? Well, it's right down the midline of the back. So what is it that's located on the back? Well, it's your vertebral column. So what we would want to do then, actually has two origins. We're going to put thoracic vertebrae and then occipital bone. Okay, so those are two spots that don't move. So then we need to think of a spot that does move. Okay, and that's going to be all the way out onto here because it actually wraps itself around, and we will put the clavicle. Now, you might be thinking, well, how's that possible? We got that sternoclavicular joint, but you got to remember the same type of action that we would see between the hips of the pelvic area of men and women is that the pelvis actually can flex outwards because it's got that symphysis pubis. It's got a type of cartilage in there. So when that can actually move, this does a very similar action. In other words, it has the ability to move because it's got cartilage on both sides. Okay, then finally, probably the easiest one that we have here, we know that this will flex the head. Okay, now whether it's flexing or moving left or right, we're not concerned. We just say flexes head. Okay, in other words, it turns your head one way or the other. So of these, okay, here's a bone, and then here's a bone. And we talked about that in class. So which one of these does not move? Okay, so in this case, it would be the sternum. And you could say the clavicle too. Okay, now in this case, yes, this does move a little bit. So some of these can be both origins and insertions at the same time. So we got the sternum, the clavicle, and then the mastoid process. And we don't need, if you want to put TB for temporal bone, that's fine. But anytime we're referring to the mastoid process, we know that that's in that vicinity. Okay, actually up here in around your, of course, your temporal bone. That's what we say TB there. Okay, thanks for tuning in. We're just doing the best we can to keep moving forward, and we will catch up to you next time.